Hey guys, and welcome to Hymology. This week's video is inspired by two subscribers who sent me the same article and wanted to get my take on it. This article is about a study that claims men who want to lower their risk of prostate cancer should ejaculate 20 times a month. Woohoo! Yeah! No, hear me out. I am about to caution you on this Harvard study. If you don't know me, I'm Sherry James RN. I help men avoid ED medications, get off of them, or in some cases, get them to work. This video is for you if you like hearing content from a real human being with a unique perspective. This video is not for you if you like hearing regurgitated AI content. Now, the reason for this video is because after reading this article, I thought, what type of sorcery is this? I'm going to start with the study. Then I'll go over the signs of prostate cancer. I'm going to go over why I don't agree with it, and also some realistic tips to help you reduce your chances of getting it. At the end, for what it's worth, I'm going to give you my take on how I think prostate cancer begins. Let's hear about that study. All right, so Caucasian healthcare professionals between the ages of 46 and 81 were asked how many times they ejaculated per month during their 20s to 40s, and also this most recent year. The team found that men who climaxed 21 or more times a month had a 31, that's a very specific number, 31% lower risk of prostate cancer than those who ejaculated 4 to 7 times a month. Now, I know a lot of guys in their 80s who'd be happy if they were ejaculating that frequently. Now, okay, so first of all, I don't know how these guys even remembered how much they ejaculated in their 20s and 40s. When I ask guys on a consult how they found me, they can't even recall the search terms that they just used. Okay, so how did Harvard evaluate prostate cancer risk? Now, there are so many factors that go into this. And I mean, the obvious one is, for me, is really healthy lifestyle choices. Now back to the study. It is unclear exactly how masturbation may lower the risk of prostate cancer, but experts believe it could be due to increased blood flow to the prostate, which is a walnut-sized organ that is found only in men. You know, that's a legit hypothesis about the increased blood flow and certainly a piece of the pie. But there is a better way to go about risk reduction. There's many better ways, and with less cost to your body. So here is my take on this study and why you should not climax 21 times a month. Now, first of all, it is a big loss of life force. There's approximately 40 million to 600 million sperm per load, and those are all carrying little sparks of your life force energy. So your body is here to procreate the species. And at the deepest level, you know, we're essentially a breeding program for embodied consciousness, which is probably a whole nother video. And your body doesn't care how much money you make. It can't differentiate between intercourse and masturbation, whether you're watching porn or having 5 sensory sex. It doesn't know if you're with a last call girl or someone you love. Once the involuntary response from the nervous system is triggered, it's time to make a baby. So don't forget, life force energy creates life. And you lose so much life force energy when you actually ejaculate. You know, that's why you get so sleepy afterwards. As a rule, whenever fluid leaves the body, you're losing life force energy. And that's also why when women menstruate, they get so tired around that time. Ejaculating 21 times a month is not listening to the wisdom of your body. It's listening to a study. And you know, if you've been watching my videos, I'm all about listening to the wisdom of your body. If you want to hear more about that, you can watch my video, What is Forcing an Erection and Why a Holistic Approach to ED Matters. So one option, instead of ejaculating all the time, is you can actually have an orgasm. This is something you can learn without ejaculating. And that's how you can start to transmute your sexual energy into a spiritual experience. And I'm not saying don't ever ejaculate. As with everything, moderation is always key. All right, so here are the symptoms of prostate cancer. Now, something important that you need to know is that prostate cancer is asymptomatic in the beginning stages. Now, as it develops, that's when you start to show signs. And some of the signs are needing to pee more, difficulty in starting to pee, having a weak flow, rushing to the toilet, or having pain in your testicles. If you are experiencing any of these symptoms, please see your urologist. Do not neglect this. Now, as for risk reduction, I think these are pretty realistic. Stress reduction. I mean, stress reduction seems like it's the number one thing to do across the board. Now, if you have a high stress lifestyle, you can counterbalance that with meditation, yoga, time in nature away from your phone. And for some of you, it may be advisable to get a heart rate variability test to see if your nervous system is being impacted by stress. I can tell you from personal experience that stress can unlock dormant genetic tendencies in your DNA. So if prostate cancer runs in your family, then stress reduction is critical. Also, incorporating more alkaline foods into your diet. These would be greens, veggies, fruits, always aiming for a variety of color. Get regular digital exams. None of this telemedicine for urology. Get palpated. And make sure you're getting at least 7 hours of sleep consistently so that your immune system can rest and do its thing. Also, hydration is critical. Drink a minimum of a half a gallon of water a day. A gallon would be ideal. What I do for myself is I just pre-fill the amount of water that I'm going to drink that day, leave it on the counter, and that is my goal, to make sure that I finish that water, and I do. Also moving your body and breathing deeply, getting oxygen into your system. And I think this one is critical, which is to give yourself a prostate massage or have someone give it to you. And what that's going to do is bring blood flow and oxygen to your prostate. Oxygen inhibits cancer growth. I want to share a personal story with you. When I was teaching Tantra and doing Tantra sessions in Los Angeles for like, I don't know, forever, it feels like, I did do prostate massage. It was something that I had to do on the down low, and I would get referrals from healthcare providers. And I mean, these guys would come to see me. Their prostates would be so enlarged. And when I would palpate, let's just use that word, it was like flames. Like there was just so much information. It was like putting my hand into a fire. And oftentimes it would take as little as 3 sessions with me to reduce the inflammation. I mean, really manually. And in my opinion, that is such an important way to reduce your risk of prostate cancer. You're getting blood flow, oxygenation, especially if you go to, someone who knows what they're doing. I mean, I wish someone would have done a study on me, because it really didn't take too long before when I would go in and palpate, let's keep this clean, no pun intended again, that you like the fire went out, so to speak, okay? And then you could actually feel that the prostate had reduced in size. So that's my experience, which is the only place I can ever speak from other than what I'm going to say right now. So it's my hunch, and take this for what it's worth, whatever that's worth to you, is that prostate cancer starts with inflammation caused by bacteria, viruses, mycoplasma, and fungus. So it's essentially a microbial overgrowth. Now, this can be tested and targeted with herbs, or in some cases, something stronger like an antibiotic. And if there are any forward-thinking holistic doctors out there that are hip to this, they're doing testing for it, and they're treating people successfully, please get a hold of me, because I would love a referral source for this. And as always, my wish for you is that you be so sexually healthy that big pharma cannot profit off of you. And I'm sorry to burst your bubble that you cannot jerk your way to prostate cancer reduction. I mean, you can try. But I think that there's a lot more to the story, and hopefully I have covered that here. And if you like this video, kindly leave me some love in the comments. If you're interested in a holistic approach to ED, get a hold of me in one of the links below. Hey you, hey guy, who's learning about sexual health, mixed in with some Tantra, mixed in with some 5 elements of Chinese medicine and some Western medicine. I want to let you know something. I would love it if you would hit my subscribe button and the notification bell. That way, you're going to know when new content is posted every Friday.